Hello, Houston, and hello, USA. This is Dr. Vicky Cruz with the Hero Network, live to you here on Aliento Radio. So today we have a special guest who is on her way actually, but in the meantime, what I want to do is introduce our co-host, Victor Escalante.
Doc, how you doing this morning?
I'm great. How are you?
Good. You're all bright-eyed and bushy-tailed as usual.
I am. I really am. We have had a just productive year already. And this month we have taken off. We launched our parent student night at Milby High School. Success. Yesterday, we also launched leadership for Milby students. Success. Next, we are launching the Centennial, working really hard. And it's not that we're launching Centennial. Let me take that back. We have a Hero Impact Day to discuss and to do a recap as to what's happening at Milby High School, how the Hero program has impacted in all of the Buffaloes here today, especially during a year where we have had, we've had 5 deaths. At the school, we have also had just dealing with a lot of what would you call it in the environment, Victor?
Well, I would say that it's been a difficult year, no question, with all the changes that are happening at HISD that is directly impacting students and families, okay? Let's don't kid ourselves. These cuts, these changes in the curriculum and the structure of HISD is directly impacting students, especially on the lower socioeconomic level and the minority students. And so we have tried to do our part. And I would say, as you said, Vicky, it's like we've been successful at it. Based upon the post-test that we're getting from some of the students as far as what they are learning, what they have been able to get out of the HERO program, and how they've been able to modify their behavior, as well as from some of the parents that have been in our parenting classes, the feedback that we're getting from them. So that's a testament. HERO is a proven program that helps students and families.
Absolutely. And so with that said, I mean, we are wrapping up the year. It has been a success. I'm so proud of the resilience of our Buffaloes. And so
we're wrapping up the school year. Okay.
We're wrapping
our
up.
work continues year round.
Exactly. So it's not done, but
Yeah.
we are just wrapping up the school year here and planning some exciting initiatives that'll come to you soon. So in the meantime, as you all know, HERO is a program where we teach children how to ask for help. In these days where abuse is real, human trafficking is real in schools, not just in the HISD, but throughout. We know that families, have different challenges, dysfunctions, discords. And what we want to do is remind that in the midst of trials and challenges, that there's a hero within everyone. And these children are so empowered when you actually talk to them from all ages, from little ones all the way to the teenagers. They're all different. We talked about that last night during our Hero Coaches class, which was another success. We had 3 more
baby coaches.
Yeah, 3
That's
more
what I call
coaches.
them.
Yeah, that came in. So it's really exciting that once a month this year we have launched the Hero Coach. Victor, if you don't mind, I want to give a shout out just really quick because
Sure.
I said I would do that. So listeners, viewers, we want to give shout outs to everyone who has supported. You know that this program was launched 2 years ago. It was launched in HISD during the midst of COVID when I was over at Wainwright Elementary. And that's a whole nother story that you'll continue to hear more about. But when
There's actually a documentary.
There is a documentary
that's about to drop.
There is a documentary that's gonna drop, an hour long, about HERO and the mission of Dr. Vicky Cruz. So what I want to talk to you about is the barbecue benefit we are doing until our guest gets here. I want to give you some updates and some praises to everyone who has supported us. We thank you so much to all the HERO coaches. I want to thank you. someone, I think I texted you today, just bought 10 tickets.
Okay.
This morning, let's see here, because I sent it to you. And it is the law office of Baldo Garza. They are immigration experts.
I know Attorney Garza. Yeah.
Yeah, he is now the district director
LULAC.
for LULAC, the District of 18.
Yeah.
Well, where I was also appointed as again for the chaplain. The chaplain. So thank you so much, Baldo. Thank you so much for that. And we want to give a shout out, of course, to the Law Gonzalez, also the Gonzalez Law Firm. Marco, thank you so much for your support, to the Segovia Foundation, AMP. Thank you so much for your support. Dr. Les Fullerton, Doc Williams, everyone who supports and is constantly just backing us up. My dear friend Maida, thank you for buying those tickets. You didn't have to do that. Was there any other shout outs?
Smoking barbecue, Smoking Monkey Barbecue.
Yeah, Smoking State Representative Christina Morales. Thank you, Christina, for always supporting us. I thank you, sister. Frank Gonzalez with Sylvia Garcia's Congresswoman, thank you so much. I want to just praise and appreciate everyone, because it's a big deal for us. Everything that comes in, we cannot do it without you.
And your donations, I want you to know that 100% of your money, of your proceeds, go directly to impact students, okay? We don't get paid a salary. None of us get paid a salary. 100% of your donations go directly to help students and families.
Yes, maybe here and there I put a gallon of tank of gas or something or what have you. But for the most part, it's all about the children. And yes, but we need your continuing support, because one day we will grow. And we're just excited for that, because what's happening, it's just creating overflow. And we are so simply excited, because we can't do this without you. It takes a village. It takes a village. Victor and I, we say that all the time. It takes a village to raise children. And right now, many of the children that are in the schools are being dropped off. And just that's what I witnessed. I came out of corporate America and I had 3 babies I took care of, right? As a single mom, I know the difficulties being a single mom, and most children are being raised by single parents or working parents, grandparents, whatever the story may be. And so it takes that village. And with cultures, Victor, and how there's so many cultures that are within our country and our city of Houston, it's one of the most diverse.
It's one of the most diverse. LA County is the most diverse. We're the second, closing up on becoming the most diverse city and region in the country.
Correct.
That's why Dr. Kleinberg says, as goes Houston, so goes the nation.
That's right, because we here in Houston, we have the talent, we have the culture, we have the resilience to rise up during any sort of heartache or any sort of catastrophe, disaster. It has proven that we work so effectively. And so we're grateful to Houston. Shout out, we are Houston strong. So be someone, be a hero, and support this cause as to what we're doing to drive unity in the community and to develop our future heroes. These are heroes, and it's a program that it includes everyone. And so we are just so blessed to have partners such as the Bridge Over Troubled Waters. Thank you. They'll be with us next week talking about Child Prevention Abuse Month. Mm-hmm. As we know, this month we're wrapping up April 30th, Child Abuse Prevention Month. And they are providing resources, continued training, Victor, and Jessica out with the Bridge is going to talk about the new training that they are provided when it comes to reporting abuse. Shout out for that. Yeah? Mm-hmm. Exciting. So we have the barbecue benefit. You want to share about that, how people can buy tickets?
Sure. If you go to our Facebook page, we have a QR code that it's a one-time purchase. For $15, you can buy obviously more, but on there's a QR code that we put up that you can you can take a picture, go directly to the page to where you can make your purchase. $15 a plate. It's a sandwich. It's a barbecue sandwich that is being done by award-winning Smokin' Monkey Barbecue cook.
Fabian Medrano.
Yes, and so it's gonna have chips. People are asking, what does it have? It's got chips, it's got a cookie, and it's got a beverage. Okay?
Correct.
So one meal for $15, or you can purchase more, or you can be a corporate sponsor, and we are very generous in recognizing and exposing your brand as an affiliate sponsor of the Hero Program,
And
as we've had so many different corporate sponsors sign up.
Absolutely. We want to definitely give a shout out to Greg Kumpian.
Yes, Mr. Greg Compean continues to be a benefactor.
He, without his support, I mean, he sees the vision. I mean, he is so...
He provided the seed money to go big.
Yeah.
Now we need to go bigger.
Exactly. He has provided what we needed. And, definitely one of our premier sponsors is Greg Kumpian with the Kumpian Funeral Home on Broadway. So for any needs that you may have, I thank you. I mean, he is close to home, close to Milby High School, and just close to family. I mean, many of you know my little baby sister passed away last month. And Greg Kumpian and his group, his team, his family, actually, we're family. Somehow down.
You told me.
Yeah, we are somehow related. And so, es primo, mi primo Greg. Pero what I want to tell you all is that, there's so many sponsors, and I know did she reach back, Dr. Lalani?
I haven't heard
She
from
has
her.
not
No,
heard
I've
back,
been
so there could be
keeping a tab.
something. Yeah,
Could be
so
something come up.
yeah, so hope Miss Dr. Lalani, who's been a visitor or a guest of ours not too long ago, she's with the Hope Clinic, a clinic that reaches out. They do not push anyone away, underserved. They do such a beautiful job. I mean, with care. They have about 5 clinics.
They have about 5 clinics, correct.
They have about 5 clinics. One is not too far from here, the Aldine campus.
Yes.
And so what we want to talk to you about is just the mission. This weekend on Saturday, we took 20 heroes. We had 20 tickets from the Dynamo Dash. Mm-hmm. And so these children had never been to a soccer game. I had invites to go to other events, but there was just no way that I could pass that up of taking these children. I posted some videos out there. Victor's about to post out on Mission One, so you can check out just the great time, the enthusiasm of these children, these heroes, including my granddaughter, little Mila. She was there.
Yeah, it's really heartwarming to see the joy in children and students when we can reward good behavior and see in their faces. Many of these kids come from disadvantaged families that if it wasn't for our support for them, they wouldn't be able to attend events like the Astros and the Dash and the Zoo and all the other events that we've taken them to. Vicky?
Oh, yeah, absolutely. We took them last week to the Houston Astros, along with, actually, we did 2 trips to the Houston Astros already within the last month. I mean, this year alone, with what's opening since opening day, the Houston Astros has blessed the Hero Program with about 5 games. And we took this time around some of our teachers at Milby High School and the PTO president. Yep. And so we are so grateful. So with that said, on May the 29th, we were able to give and incentivize the Milby High School Buffaloes for attendance, that if they showed up, they would get tickets. So we were granted 1,250 tickets for May the 29th. May the 29th. Can you imagine that? It's just, it's going to be great. It's going to be huge. And so we're excited to have not just the Hero Program, our coaches, but to have our partners join us as well. So
absolutely,
it's going to be so amazing. So also Impact Day on the 23rd of May.
Yes. So let me give you a preview of what's happening Impact Day. Impact Day is a special day that we have set aside to bring together a lot of the people that have been instrumental this year at Milby High in putting together the Hero program, but we're also bringing in other community voices to speak to students, as well as we're facilitating the kickoff of the centennial celebration at Milby High. 100 years of being in the community, teaching students. A lot of legendary students have come from Milby, and they are, some of these people are returning to be a part of the Hero Impact Day. We're also going to have a lot of success stories to where you will hear the success of some of the students. So we encourage you to contact us if you would like to be a part and attend, because this is going to be a great celebration. And I'm very happy to tell you that our guest just arrived, Dr. Lalani. She is a returning guest and a friend of the show. Dr. Lalani, welcome back.
Thank you. Thank you for having me. So honored to be here.
No, thank you for being here with us. I was so excited when Victor said, I said, is Hope Clinic, or did they confirm? He's like, yes. And I was like, yes. Yeah. So, talk to us about updates that are that's happening with the Hope Clinic. Any updates since the last time you were here?
Updates would be just continuing to grow and get busier and busier and looking at expansion.
We just said that you have 7 clinics. Is that correct?
We have five clinics,
Five.
But we're looking at possibly 2 more
Okay,
locations.
so we were predicting.
So before, I know I just jumped in to hear about what's happening. Dr. Lalani, tell the viewers and exactly what, who Hope Clinic is, and of course, your part in this organization.
Definitely. Yeah. So Hope Clinic, we are a private, nonprofit, federally qualified health center, which means that we receive federal funding, grant funding. A portion of our revenue is from grant funds. And the reason that we can take care of the underserved population, the uninsured and underinsured of Houston, is through support of federal grants. So we are here in the community to take care of those who have difficulties with access to care.
We were at your annual meeting, and we were just amazed that all the different coalitions that support Hope Clinic, all of the luminaries within your organization. I was even impressed by the little girl that she's made a name for herself by being an active participant within the Hope Clinic ecosystem.
Yeah, so we're doing great work, and we take care of the most vulnerable of our communities. We take care of the recent immigrants, refugee population, the underserved because of access and insurance. We have a really high uninsured rate in Houston, and medical care is expensive. So we are doing great work. And so as a result, we have great support because people know that what we do makes a difference.
So April is, there's several, April is known for 2 things. One is Child Abuse Awareness Month, and the other one is Minority Health. Talk to us about minority health over and above what you already said. Do you have any statistics? Do you have any specifics as far as what our audience needs to know and how they can access this healthcare?
Right. So part of what Health Clinic does is try to make healthcare equitable, right? So minorities often don't have the same access due to, health inequalities. They don't have the same access to vaccines, to well visits, to contraceptives. And so part of what Hope Clinic does is make healthcare accessible. And so through offering, there are certain private practices in Houston that don't take Medicaid, for example. We're there to serve Medicaid patients. Sometimes people have insurance that they buy through the marketplace or they get through their employers, and their deductibles are super high. And so even though they have health insurance, it's not truly usable because it's just so expensive to meet your deductible.
Correct.
And
So
your clinic,
we
yes.
offer reduced rates, so sliding fees for patients based on their income, to make that deductible really even more reasonable for them.
And your clinic has all kinds of primary care providers that speak all
Beginning,
the different languages,
yeah.
all the different
Yes.
languages in Houston.
So we do take pride in that. Our staff speak 34 languages, and we, for the languages that we don't have staff that speak, we use translation lines. Many of our doctors are also bilingual. Most of our doctors are also bilingual in at least one other language. And so we do take pride in offering culturally competent care to those of Houston.
And one thing that I appreciated the last time we heard viewers is that when these children come in and you have parents who come in, you have an OBGYN, right, that can go in, and then once the children are born.
We do. We have not only family medicine, but we have OBGYN and pediatrics. So we deliver our babies, and then we have pediatricians that we can hand the baby over to for excellent, high-quality care.
Absolutely.
And you also provide a whole host of other services that I'm sure that we don't know the all of them, but one of them that comes to mind is healthy cooking. Okay.
Oh, yeah.
You have a chef that teaches families how to cook healthy, how to improve your health through proper nutrition.
Can I come and learn how to cook too?
Yes, definitely. We'd love to have
Yeah.
you both. So yeah, that's another thing we really take pride in is our Culinary Institute, in which we go to schools, teach children about healthy choices. We teach parents about healthy cooking. We have a Culinary Institute in which we teach those who want to have their own restaurants or at-home catering, how to do it in the most hygienic, healthy way, and obtain a certificate.
Is that in
they-
every clinic, Dr. Lalani, or is that just one a
No,
certain
that's
clinic?
That's done in coordination with the Aldine Community Center. I'm sorry, the Alief Community Center,
Alief
where they
one.
have a kitchen.
Oh,
So
okay.
that's where the Culinary Institute classes are held.
But you guys are standalone. It is part of the Hope Clinic,
It is
and not like
an
Baker.
organization within Hope Clinic. It's called Bite of Hope.
Bite of Hope. Okay,
Yes.
that's awesome.
And another thing that comes to mind is you are a full service provider of all the different services. If I remember correctly, even dentistry, isn't that true?
Sorry?
Dentistry?
Yes.
Yes.
3 of our locations have dental clinics. We also have optometry in 2 locations. We have mental health services in all of our locations because it is also available through Zoom and telehealth. And so mental health, of course, is a very much needed service in our community, a growing need. There's a growing need within children and adolescents as well. So, we do offer psychiatry and counseling services
what
through
about
Hope Clinic.
Dr. Lalani? What about whenever somebody wants to make an appointment? What's that time wait to make an appointment? Is it 1 day versus 2 weeks, or what do you find if they need an
So we
appointment?
do try to, first for an urgent issue, we do try to give same day appointments. If a patient has an urgent need, they can walk in. But for something that is not so urgent and needs to be scheduled, the wait might be anywhere from 2 to 3 to 4 weeks, depending on the specialty and how many providers we have currently.
Okay.
So let's talk about the elephant in the room. Funding for different communities and different programs is being slashed or is being reduced. There's a lot of misinformation about immunizations, and this is coming from people that are uninformed, people that have an agenda that is really detrimental to you, the family, your children. So we are not here to advocate for anything other than be informed. Be informed, listen to the experts. And so what can you tell us, Dr. Lalani, as an expert physician with an expertise in pediatrics, what can you tell us that our viewers need to know about?
So I'm not a pediatrician, but I am an OBGYN. But I am very informed about the importance of immunizations. And it is something that I am very, very passionate about because there's a lot of misinformation and myths in the communities through different media, social media. And, I really hope to debunk some of those myths today because vaccines do save lives. We have diseases such as measles that
We are
were
seeing that
was
they're
considered-
predicting 600 different cases of measles. If they haven't already reached that number, the numbers are going high.
So measles was considered an eradicated
Yes.
disease. And because of vaccine hesitancy, we have seen 700 cases in the South Plains area of Texas. 700 cases. 2 of those were children who have died. Now, that's unacceptable
Yes.
in 2025 when we should have no measles cases due to an excellent vaccine and protection from measles through the vaccine. Of those 700 cases, 650 plus of those individuals were unimmunized. So when you look at a lot of these diseases, measles, mumps, rubella, tetanus, diphtheria, pertussis, flu, for example, we protect. So there's certain vulnerable populations, such as pregnant women, infants, immunocompromised individuals who may be going through chemotherapy or have some other reason that they're severely immunocompromised that cannot receive the vaccine. Okay, because they're live attenuated viruses. So it's a live virus that's been weakened or killed, but certain populations can't receive that vaccine. So the way that we protect those individuals is through what we call herd immunity. Okay, now depending on the disease, if a certain percentage of the population has not been immunized, we are not protecting those vulnerable populations. So for measles, for example, if at least 97% of the population is not immunized, we're leaving infants who can't be immunized, pregnant women, those who are going through cancer treatment, they can't get the vaccine. We're leaving them vulnerable and open
Yes.
to risk of disease. Some of the complications of measles are encephalitis, or inflammation of the brain, pneumonia, blindness. I mean, these are serious issues. Flu, another example. 36,000 people die every year from the flu. And, it's an easily accessible vaccine that a lot of people are refusing to get. And
I
so-
just read a story this morning that they are predicting now that because of the cutbacks, there won't be a free COVID vaccine next year. So again, these are critical times, and you as a consumer, as a parent, you need to be well informed so that you make the right decision. Again, we're not advocating for anything other than be informed. Know how to protect your family. Because if you choose not to vaccinate your children, you're putting at risk the community, not just your family or your kids. It's like you're having an effect on all the community because they are communicable. I assume
contagious.
measles is highly contagious.
Highly contagious diseases that have severe risks of complications.
Yes. And once you get the disease, it's too late, okay? Now is the time to be informed. Now is the time to make good decisions. Dr. Lalani, what can you tell us about parents need to know to make sure that they're up to date on their immunizations?
Okay, so there's immunization schedules, and most of us get all of those immunizations as children, but there are certain boosters that need to be given. So, for example, the Tdap vaccine needs to be given every 5 years, even after you become an adult. There's after the age of 50, there's other vaccines that are necessary, such as the shingles vaccine, the pneumococcus vaccine, which prevents pneumonia.
For my COVID vaccine, I had to get the shingles because, again, they're back, okay? That was unheard of in the past. And again, because of my cough age, I had to get that shot and others. Again, because because we are in difficult times.
I didn't know
Yeah,
that.
yeah.
I mean, I'll be 52 Sunday, and I have not received the shingles vaccine.
Yeah, so please look into that and make sure you're up to date on all your vaccines. The flu shot should be given every year. So every year they look at the 4 strains that are circulating in the communities, and the 4 most common, most virulent strains, they make a new flu shot against those strains. So that's why it's important to get a flu shot every year. And flu season, it runs from October through May. So we're almost out of flu season now. But, there's other vaccines also that sometimes we need to be caught up on.
What are you seeing at Hope Clinic as a primary care provider? What are you seeing firsthand in treating patients and
Yeah,
families?
so I'm an OBGYN and treat pregnant patients, and I'm seeing more and more of my patients refuse vaccines like the Tdap vaccine and the flu vaccine.
Again, because of misinformation, I want to share something with you that is happening. This has been documented and reported. A lot of the opinions that are out there have been manufactured by artificial intelligence, okay? A lot of the postings that are being done are being driven by artificial intelligence. It's not even real people. They impersonate and create fake profiles. And again, they feed all this stuff and it's all being done automatically. So you are being affected in your perception and your understanding that by information that is false. That's why you need to be informed by experts, not something you saw on Facebook, not or any other social media, because that is propaganda that is being distributed in wholesale.
Unfortunately, there's several myths out there. One is that the vaccines have not been studied, and that is absolutely not true. Vaccines go through rigorous trials. There's preclinical trials that occur in laboratories in mice. Then there's 3 phases of trials to make sure the vaccine is safe and effective. And then the FDA approves it. And then there's another layer of approval through the organization called ACIP. And then it's finally released to the public. So sometimes it takes 10 to 15 years for a vaccine to be approved. There's another myth that the mercury in vaccines causes autism. Absolutely not true. The amount of mercury, so mercury is one of those added ingredients that help preserve the vaccine. Okay,
But
so
mercury is in all our food.
mercury is in fish, it's in milk. We get more mercury
Yes.
through our diets than that tiny, tiny dose that's given through a vaccine. Another one is formaldehyde. Formaldehyde is another preservative that we find in vaccines. You get more exposure from going out in exhaust from cars.
Yes.
Has formaldehyde in it too. So
Correct.
everything that we do has risks, right? And just by leaving your house, you take a risk every day, right? Being in a car accident or, God forbid, a fatal accident. So in medicine, we have risks and benefits, and we weigh those. And whenever we recommend something as professionals, as physicians, it's because we've weighed those risks and benefits, and we find that the benefit greatly outweighs the risk. And so those small risks, yes, some people have reactions to vaccines. They're extremely rare. Everyone tends to get some sort of a low-grade version of the disease, and that just shows that your immune system is working. You feel a little bit sick after you get a vaccine. You just have a sore arm. You might have a low-grade fever. You might not feel good for a day or two. You're not going to get the full-blown disease. And even if some people contribute a reaction, a physical illness after the vaccine to the vaccine, whereas really it takes about 2 weeks for the vaccine to take effect. So maybe they had been exposed the day before or the day of and actually got the flu before the flu vaccine could take effect, and they're now blaming the vaccine.
Wow. What other challenges? What kind of challenges are you guys seeing today?
Uptake of the flu shot. Again, women and babies die of the flu every year, and there's just no reason for it because it's completely preventable by getting the flu vaccine.
So it's the flu vaccine,
Mm-hmm.
the challenges.
Yeah.
Do you have children?
I have 3 children.
Oh.
I have 3 girls. They're grown now, so we're past the immunizations.
Now, so you believe immunizing your children that what you give your family is what you provide for the community.
Exactly. I got all of my children immunized for all of the vaccines that were available and recommended. I still make them get their flu shot every year, even though they're all adults. And, they used to fight me on it every year. And then one year, one of my daughters got a really bad case of the flu, and I hadn't had time to take them in. Flu season had started. I usually take them in early October, but I think it came around to November. We hadn't gotten vaccinated yet, just due to busy schedules. And one of my children got a severe case of the flu, and she was like, "Mom, from now on, I'm going to remind
Yes.
you that we need to get our flu vaccine as soon as flu season starts." So, it's you don't want to miss school. You don't want to be in bed for several days and, God forbid, be hospitalized or worse from something that was preventable.
So there you have it. It's like, do you want to believe some bot on Facebook that is not even real? It's not even a real person
Correct.
that's pushing out misinformation, or do you want to hear from a live authority on what you should do for your children's health?
Absolutely. And so with that said, we want to, just have you just look at the audience, let them know this is what it is that is in your heart, what they should know, and what they should know about the Hope Clinic. Yeah. What are the final words, and how can our viewers connect
Yeah.
with Hope Clinic?
So please know that when you refuse a vaccine for yourself or your child, that you are taking a risk that your child could contract an extremely contagious, fatal disease with horrible consequences such as blindness. You're taking that risk. And when you refuse a vaccine for yourself, you're not protecting those around you. Say you have an elderly parent who can't get a certain vaccine because they're going through a certain treatment, or an infant up to 6 months of age, they don't have the immune protection that they could have, and are protected through those around them. When you refuse a vaccine, or you refuse a vaccine for your child, you're taking a risk, and that risk could be fatal.
I can already hear some parent that says, "Oh, but I breastfeed my child, and so all of my immune nutrients are being passed on to the child." What would you say to a listener like that?
Yeah, unfortunately, you might not be passing all of the antibodies. For example, if you didn't get the MMR vaccine, that can't be given during pregnancy. And so if you are not immune to measles, mumps, rubella, you couldn't get it during pregnancy, there's no way you're passing those antibodies to your baby. So your breast milk does not contain all of the antibodies that you need to pass on to your baby to protect your baby.
Good information. Good information. So if someone's watching the show, Dr. Leilani, and they want to connect, make an appointment, or get some more information, you said it's Hope Clinic.
Yeah, so our website is www.hopechc.org, and our phone number is 713-773-0803. We have 5 locations. 3 of those are in the southwest part of Houston. 2 of those are in the north part of Houston, in the Aldine area. We'd be happy to get you in for your well visit, let you know what immunizations are due for you, make sure that you are up to date on your pap smear, your colon cancer screening, your mammogram, and all of the immunizations, and make sure that you're staying healthy.
And
There you have it, listeners.
yeah, and cooking healthy.
And
Yeah?
cooking healthy.
And cooking healthy. But
we have a nutritionist too. We have a registered dietitian on our staff. And if you're interested in how to eat a healthy diet, we can get you an appointment with her too.
But what about any sort of care too for the students as far as like emotional learning as well?
We have several child psychiatrists and therapists on staff as well. So if you feel that there might be some learning disabilities, or ADD or something else going on with your child, anxiety and depression unfortunately is rampant in our children and adolescents now, we'd be happy to have them see one of our therapists or psychiatrists.
Is that free? Can it be free for someone who does not have insurance to basically get their children evaluated?
Okay, for someone who doesn't have insurance, we have an eligibility process. And that process, you would bring some documents, some required documents, and we would determine your category based on your income. Our lowest price for being seen for a physician or provider visit is $35, and the highest is $85, again, based on income. And then our our lab fees are extremely reduced because we're an FQHC and federally qualified.
Awesome. Yeah, that's nice. That's
Well, you
good
have to come
information.
back and keep us abreast of everything that Hope Clinic is doing. And thank you, Joshita, for coordinating
Always a
the
pleasure.
interviews.
Always a pleasure to come speak with you guys.
Oh, thank you so much, and thank you for all you do, because I know your heart and your passion is it's in the community.
Thank you,
And the
yes.
love that you have for all children, it's amazing. So we thank you for that, for
Thank you.
being
No,
ready.
it's my honor.
Yep. So you've heard it, viewers. Awesome questions, Victor, as always. And, Dr. Lalani, thank you. So, viewers, we need you. We need you for upcoming initiatives that are happening. So continue to follow us on Mission One USA and, .com. Victor also has our social media platforms out on LinkedIn.
Let's go ahead and you're too modest. It's like, let's go ahead and put your webpage out there. drvickycruz.com. I just completed it. So it's off the shelf.
Off the shelf, drvickycruz.com, and my documentary along with my book, Where Are You Going, is coming up. We are looking so forward to creating a lesson plan for teenage pregnancies. Students, or to overcoming challenges during a teenage pregnant situation, just like myself. Yours truly here at 17 years old, and the rest is history. When one simple question was asked, my principal, he says, "Do you want to be another Mexican on welfare?" That was his question. Do you want to be another statistic, another Mexican on welfare? And I was like, oh, let me show you something, mister. So anyway, stay tuned. Check it out, drvickycruz.com. Thank you so much. And it's Vicky with an I, everyone. Dr. Lalani, Victor, awesome job. We love you, Houston. We believe in you. Let's continue to be stronger.
Have a great week.
Love you.
Thank you.